For children with asthma, the cold and flu season can be especially difficult. Hi, I'm Veronica with WatchMojo.com, and today we're talking with Dr. Francisco Noya, the director of the Asthma Centre at the Montreal Children's Hospital, about how to better prevent colds and flus in children with asthma.
Now, what exactly is asthma?
Asthma is a condition in which the bronchial tubes, which are the tubes that bring the air from the windpipe into each corner of the lungs. They branch out like trees. In asthma, these bronchial tubes, what happens is that they become narrow. The muscles that they have around, they constrict. So the air has trouble going in and out, and the person feels trouble breathing and wheezes.
What's the most common form of asthma found in young children?
Under 5 years of age, the asthma symptoms occur only when the child is going through an infection, a viral infection of the respiratory tract, a cold, let's say. Whereas in older children and adults, the symptoms can occur at any time, meaning the person doesn't need to have a cold.
How can parents prevent that their children catch the cold or flu?
We have learned a lot with the H1N1 pandemic because the viral infections that can trigger an asthma attack are very contagious and very easy to transmit by close contact, through the things that we touch in our hands, and that's because we have the habit of touching our nose and our mouth, and that's where the virus is, so we can spread it around. From the pandemic, we learned what's called respiratory etiquette. You know, that you sneeze in your sleeve, and you disinfect your hands frequently, and if somebody's sick, you keep distance. In addition, for the flu, we have the flu vaccine.
If a child hasn't already been diagnosed with asthma, what are some warning signs that parents can look out for that may indicate that their child does have a breathing problem?
Particularly the cough that does not let the child sleep at night. That would be worrisome, should raise concern that it could be asthma. What happens is the bronchial tubes, they become very irritated. The air has trouble getting in and out, and the child has to breathe faster, becomes very quiet. And the extra effort to bring the air in causes the skin here in the hollow of the neck, between the ribs and under the ribs, to get sucked in whenever the child takes a breath. And we call that retractions.
Now, we often hear of the term wheezing or preschool wheezer. What does that mean exactly?
Wheezing, it's a whistling sound that occurs when the bronchial tubes are narrow. Doctors can hear that with their stethoscopes, but sometimes it's loud enough that even a parent can hear. Usually when wheezing is present, retractions can be seen at the same time. Now, a preschool wheezer is a child under 5 years of age that has repeated episodes of wheezing when they have a cold.
What treatment would a child get if they are wheezing or a preschool wheezer?
Well, the immediate treatment is a bronchodilator medication given by inhalation. The most commonly used is salbutamol. A very well-known brand of this is Ventolin, but commonly people refer them as the blue pump or the blue puffer. And it has to be given not directly into the mouth, but using these tubes that are called spacers. This is for children under 5 with a mask. The yellow aero chamber is called, and this is the blue aero chamber with a mouthpiece for older children. There's another group of medications that we use in asthma that are called the controllers. This will be a reliever, and it's used without any schedule whenever the child needs it in that moment. The controller medications are anti-inflammatory medications that are used on a schedule, usually like twice a day. Very well known is the orange pump or Flovent, but there's other like Alvesco or Pulmicort.
Now, do children eventually grow out of asthma?
The fact that you qualify for a controller medication, that raises the stake that you might stay asthmatic. So a preschool wheezer that has allergies, you know, to dust mites, to cat, dog, or to foods, or if the child has eczema on the skin, or if one of the parents have asthma, these are the risk factors. One that has none of these risk factors has over 9 in 10 possibilities of growing out of the asthma. Now, children that do not have any of these risk factors, but that they have frequent episodes, they're probably going to stay asthmatic.
Well, thank you very much. It was really great having you.
You're welcome.